I got an errand for you. Listen, I want you to go to Starbucks. Go to Starbucks, and I want you to get some coffee.
Go to Starbucks and get some coffee.
Bring it back here.
Bring the coffee back.
Then I want you to call your brother, find out when he's leaving his house next, and find out where he's going.
Find out when my brother's leaving his house next and find out where he's going.
Right. Then I want you to go to a stationery store, and I want you to pick up some pencils.
Pick up some pencils from
the
the
stationery store. Then you sharpen them.
Make sure the pencils are sharp.
Okay, you got it?
I got it.
Okay.
Coffee, napkin, stationery. Find out when my brother's leaving. Call him.
Ride like the wind.
I'm gone, man.
Okay.
Gone.
The peaceful atom, no longer just a laboratory dream, is here today, working wonders, providing a happier, more abundant world for all mankind. Already, atomic development is a major factor in the American economy. Thousands of men and women earn their livelihood by harnessing nuclear energy for our benefit.
X-rays are used more often and on more people today than ever before. That's because they're extremely effective in the assessment of injuries and early detection of diseases. And they are readily available in doctors' offices, clinics, and hospitals.
Some parts of our body absorb more X-rays than others. That's why parts of an X-ray may appear white and others may appear black.
The benefits of medical X-rays far outweigh the risks. Although the chances of being harmed by medical X-rays is extremely small, there is a slight increase in the chance of developing cancer later in life. And skin burns and cataracts can occur following prolonged exposure or very high doses.
It's the radiation dose absorbed by the patient that contributes to the patient dose. Some examinations expose the patient to higher radiation doses than others.
FDA works to reduce radiation doses to the public while preserving image quality by establishing safety standards for X-ray equipment, recommending good practices, and conducting educational activities aimed at minimizing unnecessary exposure. In addition, we work with states to annually inspect mammography facilities and test equipment. As a patient and consumer, you have an important role in reducing your risks from medical X-rays.
Inventor Thomas Edison created the X-ray machine. Now a Honolulu chiropractor is using a souped-up model to reveal injuries conventional X-rays can't. KGM9's Jim Mendoza has our story.
Thanks, Kyle. First, a warning. Now, some of the images in this story are a little bit graphic. The device is called a fluoroscopy machine. It is part X-ray, part video camera. A broken neck on the left, a displaced shoulder on the right. Painful to the patients whose conventional X-rays missed both injuries. They were caught on tape by DMX.
In layman's terms, I would explain to an 8th grader as an X-ray that moves.
DMX stands for Digital Motion X-ray, also called fluoroscopy. The machine exposes the root of a patient's pain.
On a really bad day, it's a 10. I mean, I'm in bed crying, I'm popping pills, I'm miserable.
Hi, Selena. We're going to take a look at your neck today and see how it moves.
Selena Unga was in a car crash. Chiropractor Stephen Meglancy used fluoroscopy to spot ligament damage.
Through motion, we can see the ligaments if they're strong or weak or stretched. Now just open your mouth and close.
Unga says regular X-rays didn't show her jaw was knocked out of alignment, as were ligaments in her neck.
So as a doctor, what we would do is focus on stabilizing that neck, getting her better. What we're going to do is called lateral bending, so keep your arms on the side and relax your shoulders.
Hospitals use fluoroscopy. Now many mainland chiropractors use it too. Insurance companies have questions.
Is it either an approved medical practice that's widely accepted, or is it something that at least we can ask the doctor and say, how does this help you?
Talk about the safety issues with chiropractic. Is chiropractic safe?
Yes, it's totally safe. And one way you can look at that is just to see how much we spend on malpractice insurance. Chiropractors spend so much less than a regular medical doctor spends about 10 times as much, and a surgeon spends probably 100 times as much as a chiropractor.
Okay.
My malpractice insurance runs about $1,500 a year, and a surgeon may be up to $100,000
wow.
for malpractice.
Okay, I'm sure that's because you don't use medications and don't use surgery, which are all very risky and very dangerous.
Its bottom line is because it's safe.
Radiation can't be seen, touched, smell, you can't hear it. So the only way an individual would know whether or not they were exposed to radiation is to have a personal dosimeter. For example, radiation exposure is cumulative. Once the body is exposed to radiation, there is a very small amount of repair. But over time, continual exposure is going to accumulate.
FDA is investigating a situation in which more than 200 patients undergoing CT brain perfusion scans at a single hospital received overdoses of radiation. In some cases, the radiation doses were high enough to produce erythema and hair loss.
While these events involved one type of procedure at one facility, FDA is concerned that they could reflect more widespread problems with CT quality assurance programs. If patient doses from CT procedures were higher than the expected level, but not high enough to produce obvious signs of radiation injury, the problem could go undetected and unreported. And this could put patients at increased risk for long-term radiation effects, including certain types of cancer.
To help prevent overexposures, FDA is encouraging facilities that perform CT procedures to be aware of the dose indices displayed on the control panel. These indices include the volume CT dose index, expressed in milligray, and the dose length product, expressed in milligray centimeter. Before a patient is scanned, the operator should make sure that the values displayed for these indices correspond reasonably to those normally associated with the procedure being performed. These indices should be checked again after the patient is scanned.
FDA is working to obtain more information on reports of CT overdoses, and we encourage you to report these when they occur. You can do that by going to our website.
This consumer update is brought to you by the U.S. Food and Drug Administration.
The New York Times reports that urgent warnings by government experts about the risks of routinely using powerful CT scans to screen patients for colon cancer were brushed aside by the Food and Drug Administration. This is according to agency documents and interviews with agency scientists. The average lifetime dose of diagnostic radiation has increased sevenfold since 1980, driven in part by the increasing popularity of CT scans. Such scans can deliver the radiation equivalent of 400 chest X-rays. An estimated 70 million CT scans are performed in the United States every year, up from 3 million in the early 1980s, and researchers estimate as many as 14,000 people may die every year of radiation-induced cancers as a result. A group of FDA scientists who are concerned about the risk of CT scans say that FDA managers ignored or suppressed their concerns, and that the resulting delay in making these concerns public may have led hundreds of patients to be endangered needlessly. Scores of internal agency documents show that agency managers sought to approve an application by General Electric to allow the use of CT scans for colon cancer screenings over the repeated objections of agency scientists who wanted the application rejected.
Anybody not wearing 2 million sunblock is gonna have a real bad day, get it?